as we age, our skin and tissues in the face lose ability to regenerate. Therefore, we use natural methods to fight those signs of aging. The fat cells, which we all have, also contain stem cells, and when we harvest them and inject them, they replace the lost volume in our face, and they also they keep regenerating skin, muscles, and bones. And part of this is because stem cells in the fat, they keep replicating, so they maintain new cells, and also they differentiate it into the tissues which we need in the face. Those are fat, bone, cartilage, muscle. In addition, they keep producing growth factors which are released on the site of injections, and those growth factors decrease inflammation of the tissue and also reduce the natural cell death. So as we age, we are losing tissues in our face, we are losing bones, cartilage and muscles, but especially fat. Fat is organized in our face into little pads which are placed all over our face. And as we get older, our face starts looking like a deflated balloon. So in order to replace this volume loss, we would use this fat transfer for our own body, usually it's abdomen. So that's the one way how we can use those fat cells to replace the volume loss. But also, if you break down the fat cells, we get a lot of growth factors which are within those fat cells. And if we inject them on the skin surface, we can improve skin wrinkles and skin texture. Normally, patients would see dermatologists and get all other sorts of treatments. This requires also patient commitment, while by using those fat, our own fat, we can use only a few sessions and results are permanent. So we all have at least a little bit of fat, and we can usually do this procedure on the site on the day of a patient's visit. We would usually try to extract fat from the belly, or sometimes we use inner thighs, or in men we can search the fat on the back or on the back of the hand. Usually we can extract quite enough amount of fat which further on can be processed and then inject in the face. Theoretically, results are permanent. Now patients need probably 2 or 3 sessions, and that's because on the first injection, so when we inject first time, the volume is slightly decreased because the local anesthetic and serum get washed off our face, and the initial volume gets lessened. So we need to repeat this process in a monthly basis, probably 2 or 3 times. It depends on the age of person and on the severity of signs of aging. But once we achieve desirable results, then that's permanent. And not only permanent, as stem cells starts to replicate and produce new tissue, we theoretically can reverse the aging and even stop it, which is a very new way of thinking.